Good morning, sir. I will be the one reporting for our SGD about the digestive system. So for our first disease, which is the peptic ulcer disease, peptic ulcer are sores that develop in the lining of the stomach, lower esophagus, or small intestine. Most of the symptoms are weight loss and abdominal pain. For the pathophysiology of peptic ulcer is usually formed as a result of inflammation caused by the bacteria H. pylori or Helicobacter pylori. These bacteria are common in dirty utensils, contaminated water, or in the person who has been infected with this bacteria. Other causes of peptic ulcer are nonsteroidal anti-inflammatory drugs and the hypersecretion of HCl or hydrochloric acid. In relevance to nutrition, a person with peptic ulcer should stop smoking cigarette, drinking alcohol, and caffeine since these things are not good for the stomach. Thus, it is also advisable to take prebiotics since prebiotics are the food for the good bacteria in our stomach. Thus, good dietary practices with adequate nutrient, thus the timing and size of meals should be managed well. For our next disease, which is the dental caries, or basically sira sa ngipin, the anatomical and physiological concepts are inflammation and infection on the pulp from the microorganism, or inflammation in the innermost layer of the teeth, and abscess of the alveolar bone or nasa alveolar bone, and apical periodontitis, or inflammation of the periodont tube. So the pathophysiology of these are structure of the tooth. If the tooth is impacted, it can also cause dental caries, or it can destroy other teeth or tooth. And immunologic response to bacteria, composition of saliva in the mouth, dietary carbohydrates are also hydrolyzed. Bacteria, so simple sugars, it is the fuel and it produces acid. And if the acid level are falling. In relevance to nutrition, a person with dental caries should eat fiber-rich vegetables and whole grains, since fiber can help stave off dental problems including tooth loss, gum recession, and jawbone pain. Thus, a person with dental caries should also avoid eating sweet foods, chocolates, because it can increase the destruction in the teeth. So for our next disease is the gastroesophageal reflux disease, or also known as GERD. So it occurs when the stomach acid frequently flows back into the esophagus. So pag yung stomach acid, bumabalik siya sa esophagus instead na nasa stomach lang siya, it is already gastroesophageal reflux disease. So the pathophysiology of GERD is it is caused by the weakness or relaxation of the lower esophageal sphincter, or the valve in the lower esophagus. So in relevance to nutrition, a person with GERD should avoid eating peppermint, garlic, onions, oily foods, and spicy foods, since these types of food triggers the relaxation of our lower esophagus. So because of the relaxation of the lower esophagus, yung valve sa lower esophagus, then the stomach acids can already backflow. Plus, a person with GERD or any person should also avoid lipas gluten since it can increase the acidity of our stomach. So our sources for this are Principles of Anatomy and Physiology by Tortora and etc. So that will be for our report. Thank you for listening.